Welcome to the Motivational Midwife. My name's Lynn Jones, and today we're going to look at fluid balance. So we're going to look at fluid balance, and firstly, apologies for my very croaky voice. I've had a bit of a chest infection for the last few days. So fluid balance, why is it important? What is it? So it's fluid balance is that maintenance of the balance between what we take in and what we pass out. And that keeping that nicely balanced means that all our organs, all our cells, will function correctly. If we have a disruption to that, it is going to affect our metabolic and electrolyte functions, which will then have a knock-on effect physiologically to us. So dehydration, when we're talking about dehydration, think output. So you've got more coming out than you have going in. And fluid overload, you've got more going in than coming out. And if there's a disruption to the fluid balance, it can be an early indication that that patient is deteriorating. So some of the risk factors. So obviously in maternity, we always jump to blood loss, so postpartum hemorrhage particularly. But we've also got vomiting and hyperemesis. So gastric upsets, things like your norovirus, the diarrhea and vomiting, some medical conditions, diabetes, potentially more at risk of fluid balance, more sensitive potentially to fluid balance disruptions, an acute kidney injury. So this is just acute kidney injury is a sudden rapid decline in kidney function. So it's not something it's not like chronic kidney damage where this has been going on for a long time. This is a really sudden deterioration in kidney function. And it can be a complication of things like infection, so sepsis or dehydration. But also some medications can have an effect on the kidneys as well and the kidney functions. And it is something that really does require urgent care. So within that acute kidney injury, you've got things like your pre-renal, where there's not enough blood flow coming to the kidneys. So that would be things like dehydration, postpartum hemorrhage, blood pressure dropping. If you've got intra-renal kidney injuries, it's things, there's been damage to the actual kidney tissue. So things like infections that have damaged the kidney tissue, and again some drugs like your non-steroidal anti-inflammatory drugs can cause a problem. And then you've got your sort of post-renal acute injury, so things that are blockages, things like kidney stones, tumours, for men, enlarged prostates potentially can cause a problem as well, obviously not for maternity. Think about IV fluids. When we've got women on IV fluids with the epidurals or post-surgery, be very mindful about how much is going in. It's very easy to overload someone with IV fluids. People that are going for surgery and so are starved, nil by mouth. If that surgery is delayed for any length of time, then you need to be thinking about how we're going to replace the fluid that they're not taking in orally, so they don't become dehydrated. Look very carefully at your Muse score to see if there's a deterioration developing, because as I'll talk about later, urine output is one of the early signs of deterioration. Sepsis, as we've said, can cause serious problems from a fluid balance perspective, because you have that shift. If you've got sepsis, particularly septic shock, you've got that shift of fluid from um, intravascular to extravascular spaces. And this is not an exhaustive list. There's many, many more things, but these are the more common things. So why is it a problem? Why is dehydration a problem? Well, it has a knock-on effect for a lot of things. So from a circulation point of view, if we've got dehydration, the blood is thicker, the heart has to work harder, blood pressure potentially drops, leading to dizziness, potentially shock. You've got electrolyte imbalances going on in there, so particularly with sodium and potassium, and that can lead to cardiac arrhythmias, which can lead on to cardiac arrest. With the brain, you've got reduced oxygen flow to the brain, which can lead to mood swings and confusion and impaired cognitive functions. Kidneys, obviously, we've talked about as well. We've got the buildup of waste products, increase in things like urinary tract infections, kidney functions, kidney stones, seizures with the electrolyte imbalances. We've also, with heat regulation, because if you've got dehydration, it affects the body's ability to sweat. It's not actually able to cool down as it would do normally. So that can lead to heat exhaustion and heat stroke. So some of the signs of dehydration, you've got urine output. Now, urine output is really important, and very often we just kind of round it up and say, 100 mils over 4 hours, it's 25, 30 mils an hour is okay, but actually that isn't okay. It really should be very, very accurately done, and that is 0.5 mils per kilo per hour. And I know I've spoken about this in previous sessions that I've done. But actually, so for somebody who is 50 kilograms, then 25 mils an hour is fine. It's about half your body weight. But if I weighed 100 kilograms, then actually I should be peeing out about 50 mils per hour. So there's a big difference. So if you've got somebody that's weighing 80, 90 kilos, they should be 40, 45 kilos, 45 mils an hour. And that's a big difference. So it could be an early sign that actually something is not quite right. If you're dehydrated, that urine often becomes very much more concentrate, much darker in colour. The skin becomes quite, if you were to sort of pull your skin up, the elasticity is affected, so it doesn't bounce back quite so readily. You'll get a delayed capillary refill because there's that less volume there circulating. That lack of oxygen going to the brain can lead to the sort of dizziness, confusion, which makes people more likely to fall. Obvious things you might think about is the dry, sticky mouth, the tiredness, fatigue. Eyes look like they're sunken in and can be quite dark circles under the eyes. Weight loss, low blood pressure, and because the heart's working harder, you get an increase in heart rate, so tachycardia. But often that tachycardia is not because the volume is less, that dehydration. Then the pulse is not a big bounding pulse; it's often a weak, thready pulse. And sometimes you'll get that peripheral shutdown, so the hands and feet are very cold. So why worry about fluid overload? So one of the real issues is something called pulmonary edema, where that fluid buildup happens in the lungs and it will lead to shortness of breath, something I'm feeling currently, which can lead to respiratory arrest. And then if that is not treated promptly, cardiac arrest. So some of those signs and symptoms, of course, you get if you've got fluid overload, then often you will get peripheral edema, so swelling generally everywhere. And when people lie down, it's harder for them to breathe. If you were listening into their lungs, you might often hear those sort of crackles and crepitus in the lungs. You might have high blood pressure as well. Commonly, you'll get this jugular vein distension, so you'll see that jugular vein really distended in the neck, and the shortness of breath, we've said, because of the pulmonary edema. pulse, because you've got a lot of fluid going there, that you've got a tachycardia, but it's a strong bounding pulse, and that rapid weight gain. Okay, so you're putting an awful lot of with fluid overload. You're putting a lot of strain on the cardiovascular system, and with the blood pressure increasing because there's an increased workload, it's very quickly going to lead to heart failure. Often you can have quite a bit of discomfort from that edema, so you get headaches, which could be sort of cerebral in nature, cramping limbs, stiff joints, tiredness, as we've said. Not only can you get that sort of pulmonary edema, but fluid overload can also lead to multi-organ dysfunction and, again, acute kidney injury, as we've said before. So, excess fluid will increase the pressure everywhere, so it distorts tissues. That fluid that has escaped into interstitial spaces is going to affect how oxygen gets to the tissues, so you get decreased oxygen delivery, and that's going to impact ultimately on your normal organ function. The organs that are most at risk, obviously, are those that need a lot of oxygen, so your heart, your brain, your lungs. So thinking about preeclampsia particularly, we really do need to keep balance very much as the risk of pulmonary edema, so that fluid seeping into the lungs is very high. Okay, so we need to keep that balance between the right amount and over infusing. We don't want to predispose to renal complications. Okay, so generally, for PET, you would be looking at 80 mils an hour, but that's 1 mil per kilo per hour. And that's kind of an average, but that the correct calculation should be 1 mil per kilo per hour, and that's from all routes. So if you have IV fluids going in, but she's also having oral fluids, the total, and drugs, oral drugs, total combined amount should be 1 mil per kilo per hour. Very often you will see a decrease in urine output with PET, and sometimes they will suggest a fluid challenge, but we want to try and avoid that in preeclampsia. We're looking for that 0.5 mil per kilo per hour urine output, and very sadly, fluid overload contributes to 1 in 2 deaths from PET. So within those sort of embrace reports, women who've died as a complication of PET, then fluid overload has contributed to nearly half those deaths, which is really quite scary, I think. So it also reiterates why this is really important and why we're not very good at it. So good practice would be monitoring that input and output. So if you have, and I know this kind of happens across the board, but very often if you have somebody that has had surgery, they really should be on a fluid balance chart. We need to be monitoring all the output from all sources, so vomiting, blood loss, urine output. If they have diarrhea, then measuring that as well, because it is all output, and close monitoring of the input. So what IV fluids, what oral fluids is she having? Documenting accurately. So really, within whatever system you're using, be it a paper system or an electronic one, we should be doing a check on that at least every 4 hours. And in most fluid charts, there's a 6-hourly sort of totting everything up to just see where we are. So we're calculating, are we in a positive or a negative balance? Think epidural as well. Really, if you've got an epidural going up, in many cases there'll be IV access, and often in many trusts IV fluids put up because of that potential risk of the blood pressure dropping. But how many of us actually start a fluid balance chart when the woman has an epidural? I would say it's probably a little bit sporadic. Some people might, some people won't, because we don't normally think of it. It's just a natural thing we do, isn't it? Is put fluids up, and we don't think potentially about fluid balance at that point. But there is the potential for overload there. So we do need to be having a fluid balance chart started if they're having epidurals. If for any reason they become nil by mouth, you should start a fluid balance chart to make sure that they actually are not becoming dehydrated. And the urine output. Okay, so think about if the urine output is actually quite low, do we need to have a discussion about whether a catheter might be important to really monitor closely that urine output? So all in all, I think it is really taking on board just how important fluid balance is, and how if we don't get it right, it can contribute to the deterioration and in some cases the death of some of our patients. So I really do think it is something to take away and think about and improve your practice on. And there you have it, fluid balance and why it's important. I hope you found it useful. If you haven't subscribed to the channel already, please do so, and I look forward to seeing you next time.